Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. We're seen on UVerse Channel 19 and WEYW19.com. I'm here with my good buddy and dear friend and wonderful dentist, Dr. Richard Geronemus. Richard, I am amazed at what you and your restorative colleagues can do. If they took away my license to be a periodontist, I had to go back to become a dentist, I'd have to go back to school for about 3 years to catch up. By the time I got caught up, things would change again.
That's right.
You have a lot of materials in your office that have come and gone. You must have a lot of things that you don't use anymore. How does a dentist, somebody out in practice, not somebody in a university setting, keep up with the latest, the leading edge of what's happening in your field?
Well, that's a really, really good question. And you don't want to follow what the detailed salesmen, want to sell you. You have to really research it. You go to the experts. You go to meetings. The Society of Dental Aesthetics that we are both members of meets once a year, and they have for 3 days incredible meetings. They have lunch seminars. They have breakout seminars.
Hands-on.
You learn as much from the seminars as the guy sitting next to you or the woman sitting next to you, as far as what they're doing. Extremely, extremely important. And very surprisingly, the newer materials are necessarily the better materials. Right. Unfortunately, companies are driven by stock, their prices, and always to come out with another product. It doesn't mean it's better. So you got to be careful, otherwise you will have drawers full of materials that you're not happy with. So there are many, many courses. Dr. Strupp in the middle of the state. You have all the respect. The Florida Dental Association has a meeting once a year. These are where you learn. You listen to your detail person, you read all the literature that comes out, the magazines, but then you go to these meetings and you ask questions.
You know, my mentor was Dr. Mort Amsterdam, who was the father of periodontal prosthesis, and when I was in school, I remember him saying that you can have 2 guys out 25 years. One guy will have 25 years of experience. The other guy may have 1 year of experience 25 times.
That's a very, very well put. And there is a difference in practices, as well. Because unfortunately, in today's day and age, with computerization and insurance, everything's got a number. And when you come to our office, the bottom line isn't what determines what you get or how we approach your health care. It's very, very important to look at the patient, I feel that I am a dental health doctor. I am not a tooth doctor, all right? Our practice is we charge for a service that's given to the patients. We don't have to look on an insurance code to see, is it going to be covered and are you going to get it? Because if it's not covered, you're not getting it.
Right.
So we do so many things to prevent to protect general medical health, which there are no codes.
Well, there are tremendous relationships today that are established between periodontal disease, which I treat, with heart disease, stroke, diabetes, low birth weight babies, pancreatic cancer, Alzheimer's disease, and it just seems to be growing and growing.
Absolutely.
I interviewed a veterinarian before. He said, the mouth is the entry gate to the whole body, and it's true. And if we can make people healthier in their oral cavity, many of their medical conditions will be easier to control.
Oh, there's no question. I tell my patients, the mouth is in between the brain and the heart, and don't think we're all connected. So there are certain aspects that are changing that patients have got to be aware of. And oral cancer is one of these situations where you think that people are not smoking or chewing tobacco. Oral cancer is rising. And why is oral cancer rising? It's because now it is a sexually transmitted disease. It is the HPV virus that is causing it. Now, that's the bad news. The good news is it's a little bit easier to treat and quite not as invasive. But you have to be aware of that aspect of the causative factors. And Parents have got to be aware. You inoculate your children with Guardia, both girls and boys, at the time to protect them, because the HPV virus can surface at any time in their lifetime.
Okay, we're going to get back to oral cancer in a moment. It's Dr. Kenny Levine with Health Talk. We'll see you in just a minute. Thank you.
Smile, though your heart is aching.